Hi everyone, I'm Yeow, one of the clinicians here at Annabelle Psychology. Today I'll be sharing some thoughts regarding the experience of grief and loss in relation to the COVID-19 pandemic. This is a very strange, very bizarre time for all of us, trying to make sense of how things have become the way they are now, while still trying to adapt to the ever-changing, ever-evolving situation. It is likely that a variety of feelings may be triggered within us, one of which being grief. So grief is a complex emotional experience, usually a collection of feelings that are evoked by a significant loss or significant losses. Grief can come in many forms. Sometimes we don't even know what these feelings are. We don't even know how we feel, let alone being able to name or identify them. Grief can also manifest in a physical sense of discomfort, tension, exhaustion, a nagging sense of feeling unsettled, and so on. With the social distancing and stay-at-home measures, we experience a variety of losses in our life. A loss in normalcy in our daily routine, our daily structure, not being able to go to work, not being able to go to school, not even being able to go for exercise. We experience the loss in income with business closures, reduced working hours, reduced working shifts. There is also a loss in physical connectedness and social interaction with our friends, our family, our extended family. Our sense of freedom has also been deeply restricted, and our sense of safety has also diminished, especially when we are fighting a virus that has no face, that we can't see. Dealing with the virus spread is already hard enough, but most of us are also being cut off from our usual support networks. Especially for people who are living on their own, being isolated can intensify feelings of loneliness. But on the other hand, for those of us who are isolated together with our family, this can serve as a source of support. It can also magnify friction or tension, being in such constant close proximity. One of the ways that we can make sense or understand the complex feeling of grief is a model that has been established by a psychiatrist in the 1970s, the Kübler-Ross Model. It identified 5 stages of the grieving process. Of course, grieving is not just limited to these 5 stages, but it serves as a useful way to think about the potential ways that we are reacting to this pandemic. These stages also don't have to come in order, and we don't necessarily have to experience all of them. One of the stages is denial, where we are kind of thinking, the virus is out there, it's very far away, it's not going to affect me, it's not going to reach me. Another stage is anger, where we are thinking, oh, this is ridiculous, my freedom has been taken away from me, I can't meet my friends, I can't do anything that I want. Another feeling that we could experience is sadness and despair, where we're thinking that, oh, you know what, I'm already losing my business income, I'm already falling behind in my schoolwork, so why bother trying anyway? Sometimes we might engage in bargaining, where we think, oh, this is going to be over soon, I'll just have to stay safe for 1 month and things will definitely go back to normal. So we are kind of trading off our freedom now for things to definitely go back to normal in the future. There's also acceptance, where the reality of the situation sinks in and we think, okay, this is really happening. I'm going to have to do something about this. I'm going to have to deal with it. And it's only with acceptance can we more effectively deal with this pandemic. There's also another kind of grief that is called anticipatory grief. We know that the pandemic is far from being over. The virus is still out there and it's still spreading. We are mourning over what we already lost and also what we have yet to lose. In such times, it is beneficial for us to allow whatever feelings we experience to just arise, to sit with them and to make sense of them. We are individuals unique in our own way, and we do have different ways of processing and dealing with the situation. So it's perfectly reasonable if you're feeling upset, frustrated, angry, guilty, scared, and so on. But it is equally, if not more important, for you to be kind to yourself. Because in such times where we have little control, we focus on what we can and we work with what we have. One of the comforts I take in this time is that we're all in this together and knowing, as we have always done so historically, that we will be able to get through this in time.